episode of Owning Her Health. It is October Breast Cancer Awareness, and I have the wonderful, beautiful Susannah Haarmann on my show today, who is a global leader in the conversation of breast health and oncology, amongst her other work in women's health for pretty much as long as she's been a physical therapist, over a decade. And we get into her program, which she just launched, Kick Pink, which has a side for empowering people who have experienced breast cancer. It's been a membership for a little bit of time, but now she's launched a side companion where she is helping practitioners get much more proficient in the care side. So whether you are a practitioner or someone who has been experiencing breast cancer, or who is somebody who knows somebody who is experiencing breast cancer, aka what I've just said means every single woman pretty much fills in one of those three places, then this is the show for you.
Welcome to this episode of Owning Her Health with your host, Dr. Lisa Holland. Join Lisa as she starts the conversation on what it really takes to become a healthy, wealthy, and whole CEO of your life. Listen in to real talk by real lady leaders in all walks of life as they open up on personal health stories, wealth, career, and feminine abundant living. Learn how to grow by owning your body, expanding your mind, and aligning your soul with the purpose only you can pursue in this world. Happiness begins with owning her health right now.
Wonderful. Thank you so much for being back for another episode of Owning Her Health. As I said in the introduction, this is Dr. Lisa, and I am here today with a wonderful, beautiful fellow goddess, wisdom talker of the feminine vibe and of the womanly ways. Susannah Haarmann is in Asheville, so that's with me down in Carolinas, and she's been working how many years now in women's health, Susannah?
13
years. And how long you been a physical therapist?
14
years. So dedicated most of her career to women's health. And of course, October is breast cancer awareness, and we start to see all of these things. So I was really excited to see that Susannah has a brand new offering for professionals. And I contacted her and said, hey, let's talk about this. And I wanted to catch up with her anyway. So thank you, Susannah, so much for being here. You have your Kick Pink Pro, and you've got your patient education handouts that you help with professionals. So you're really making it easier for people to get, to do the work and love the work that they're doing and not get bogged down so much.
I'm streamlining patient care for breast cancer and pelvic health therapists.
Yes,
absolutely.
Love that. Because that's really what we need. We need to kind of how can we link into each other with our gifts and talents? And I think so much now, coming out of this pandemic for the next decade, hopefully we can see interprofessional sort of collaborations there, so that we can all be up to our talents and gifts. So why don't you give our audience who may not know you quite yet a little synopsis, who you are and how you came to be with doing the work that you're doing in the world as your medicine, and right now where your heart is really in what you're doing.
Big questions. So my name is Susannah Haarmann, like you said, and I am a physical therapist specializing in pelvic health and breast cancer rehab. So I am also an educator, do continuing education courses in both of those realms. And breast cancer rehabilitation is really my baby. So like I said, I've been practicing. I graduated in 2007 and pretty much went immediately into pelvic health rehabilitation. I think that I was the second or third pelvic health therapist in the state of Georgia at that time. So it really required a lot of self-launching after continuing education. And that gave me a lot of compassion for not only the therapists who I have been teaching with continuing education over the years, but also with my own history and background. I think that a lot of us have trauma. I had a lot of compassion for what the patients were going through. And I never wanted to lose my vision for the benefit of the patient in terms of trying to rationalize their plan of care and figure out the problem and palpate the thing. And I realized that there was a great amount of mentorship that needed to take place in order for me to perform pelvic health to the level that I wanted to be able to serve people. So I went and I did a residency at Duke University in women's health rehabilitation, and that was in 2011. So I was really going for the pelvic health component, but as a requirement of the residency, you had to go through certified lymphedema training. And this was before the residency even started. And that was 2 weeks of really being excited of getting into that field as well. So I came out I entered the Duke residency having a lymphedema background and treating a lot of breast cancer patients, because that's what a lot of people think that breast cancer rehab is
Right.
It's lymphedema treatment. And that is absolutely not the case.
Right. And for those of you who might not know what lymphedema treatment, although you probably heard it by now, that's when you have that swelling, and we're working on kind of like reducing that swelling through things like compression garments and very gentle massages and techniques and things like that, wrapping and stuff like that. So I would agree, right? Everybody's like, well, you don't have the breasts there anymore, so you're treating the after effects.
Yes. And breast cancer rehab is so much more than lymphedema treatment, but that is essentially what most referrals are for. That's what doctors think that breast cancer rehab is. So I was treating these patients, and because my mother she was diagnosed when I was 12 years of age with breast cancer. And I was really her primary caregiver. My sister took care of a lot of the logistical stuff, and I took care of a lot of, the medical and emotional side of things. So, so that really impacted me, and it gave me a lot of compassion and for where my patients with breast cancer were at. And I was asking questions that no one had asked them before. And I was shocked. Mm-hmm. And then I figured out the level of care for breast cancer 10 years ago. And it was basically the goal was to save the person's life and to prevent reoccurrence. But there were all of these side effects, and I knew that we could treat them. And I went to the research, and the research was absolutely scant. And a lot of it wasn't very beneficial to the patient. For example, post-mastectomy pain syndrome. Basically the research at that time was saying, well, it should be a peripheral nerve issue. We're treating it with gabapentin and all of these things. It's not fitting within a typical healing time frame. So these people must be crazy, and
let's just forget the whole trauma.
Let's just forget the whole trauma component of it. Right. And so going back to, my personal history of caring for people who had breast cancer at a young age, there was my mother when I was 12, and there was my best friend when I was 25 going through PT school. And she passed away pretty soon after I graduated. But when I was 12 years of age, I was flushing my mother's port after surgery. And, I was with her over the toilet when she was vomiting and losing her hair. And I know what it felt like to hug her and have her shrink away, because, she did have post-mastectomy pain syndrome and brachial plexus issues afterwards. She had balance issues. She had so many issues that could have been prevented and definitely could have been treated. And they've followed her. This is 30 years later almost, and some of those have followed her. So a lot of my messaging with breast cancer rehab has to do with comprehensive care and treatment. So I think that it's a very practical understanding that we should be able to treat, prevent, and alleviate the side effects of breast cancer, and that early intervention is the best way to do that. But then I want to take it further, and I would like to, like you said, collaborate and create a community. And we'll get into this a little bit more in the future, but have it be whole body healing.
Right. Because it is the whole person.
Yes.
And, we get into treating these body parts. And I think, Cancer is a unique population, oncology and whatnot, in many ways, because of I guess, the difficulty and the rampant, amount of people that came up with cancers over the past, whatever, 30, 40 years. To some extent, those of us like myself that have been in integrative sort of perspective for a long time, mind, body, soul work, this sort of stuff. It's like oncologists were like first on board with like introducing anything else to kind of see the whole person. But it was sad because it was basically like, well, there's nothing else we could do. We might as well make them feel better in more of a palliative way, when the reality is, thank God, whatever, 20 years down the road, 30 years down the road, now we realize, wow, all of these things can be not only just prevent cancer diagnosis, but the dis-ease and understanding, that's what I'm hearing from you. There's a dis-ease in the way people are living before it, during it, after it, and I'm hearing
Yes,
you're somebody
absolutely.
to really address that.
And a lot of the mental and spiritual crisis that can happens a lot of times after treatment, when the doctors aren't in the family are just ready for their mother or their family member to come back and for life to be normal. And in terms of treating patients holistically, it does take money. I remember my best friend, she was 25 when she passed away. And she loved going to her art classes and her Reiki classes and just things that were offered at the cancer center. But those things we walked for every year. And after she passed, we would fundraise for those cancer rehab services. And then essentially they aren't there or in that community anymore.
That's
so
sad.
I think that, I do think that a lot of medicine is driven by payment and payers.
Oh, definitely.
And yeah. And as far as a lot of the comprehensive care does prevent reoccurrence from happening. So it actually is a better model of care, but one that's harder to get payment for.
Right. And I think it's in that whole bigger picture of, guys, we know, like, lifestyle healing, lifestyle medicine, a lot of stress management, a lot of things that don't necessarily take a lot of tech nor medications, nor a lot of interventions other than behavioral change and then societal change in terms of like, what is healing? Healing could just be a part of life, as opposed to be thinking of it like only when you're XYZ diagnosed, or, what is wellness, like that's another thing, like I see in all diseases, which is frustrating, but definitely it's this idea that you don't even address the whole person in cancer care. They're even like scared to have you do like wellness stuff, like while you're getting treated, like the diet and all of these things, which is kind of ludicrous when you think about it. Cause it's like, if I was going into training for any event in the Olympics, like that would be part of the routine. And so like, one of my questions I'm always asking guests on this show is like, if you could go back 10 years and tell that person, what would you like to say? I mean, you basically were like, no, I talked to her and I was like, this crap's gotta change right now.
Mm-hmm.
Where is, let's talk a little bit about your Pink Pro and your thoughts on all that in attacking this. It really is a cognitive bias, because we've got the medical community who are taught in one way of systemic diagnostic management. We've got the science that really kind of says, you know what, guys, I don't want to put you out of a job, but you either better learn a bunch of other stuff, because we actually have a lot more control if we would address these other factors. When you said, let me put together this Kick Pink Pro, and let me put together these, patient handouts or whatever, like, yeah, what's the impetus there?
Right. So, so when I went back to that research and I was going through it and it was so scant, I guess I'll just go through a little bit more history. I already knew that was an area that I wanted to fill. I just didn't have the confidence to do it yet. And that, life has an amazing way of just kind of opening doors and smacking you upside the head and speaking to you. So I went to a course out in Seattle. I was late. I sat down next to Holly Herman, and Holly Tanner at the front of the class was saying that they would like to have oncology coursework created and to speak to them if you were interested. And so I said, I want to create a breast cancer course. And Holly held my hand up, and she was like, all right, great. Well, I didn't think that I could do it on my own. And I did try to start with partnering with other people. And essentially I did go out and did do it on my own. There have been many iterations of this coursework, as I am happy to say that the research has absolutely evolved and is snowballing. And it's so exciting. And I've taught this course internationally, and you look at what is happening in Australia and New Zealand, and, internationally, I hate to say it, but the States are falling behind, and we have some catching up to do. And a lot of that has to do with insurance reimbursement and payment. So there's, I'm just like, I'm always trying to look at a better way. And so going back to the coursework, so I created the first that I know of comprehensive breast cancer course in rehabilitation. And so I was teaching that in person internationally. And then last year, of course, COVID hit, and there was no patient care to be done. I was a teacher with Herman and Wallace, and was not teaching my average of 15 times a year anymore, so I had a plethora of time, and I didn't realize that for the vision that I had, so the long-term vision of mine for Kick Pink is to help prevent and alleviate the side effects of breast cancer so that people who have breast cancer can heal mind, body, and spirit. And that is accessible to all. So with online, we can do that. With collaboration, we can do that. And that will be under the umbrella of Kick Pink.
Beautiful.
Thank
Beautiful.
you.
Beautiful
Thank
vision.
you. So this is really my life's work and my lifelong mission. I love pelvic health, but this is a severely underserved area, and one that has impacted me greatly, and one that I know that we can make massive waves. Unfortunately, I am one person, but in my teaching, I have met very, very passionate, very capable practitioners, but there aren't enough of us. Where we are at with breast cancer rehab is probably where we are at with pelvic health 20 or 30 years ago.
And we are, and when you think about it, anyone who's listening to this, I don't know how much you know about pelvic health, but chances are you only really heard a lot about it or thought about it either because you personally underwent something or you finally heard it. Like, I don't know. You tell me if I'm wrong, Susanna, but probably like what, the last
5 years, probably.
Yeah, 6 years. I feel like 2014 was kind of like the breaking point. 2014.
Then it started to get hot. Yeah.
It started to get like hot and heavy, and people were like, "Oh, I think I'm going to be a pelvic health person or something like that."
Right. And when I began teaching, people came to courses because they usually had a story about why they wanted to be there.
Right.
And then as I continued to teach over the years, the story was kind of like, well, I got hired by this person. They asked me to fill this thing and create this, this rehab niche in our area. And that's amazing. And that's awesome. But I always pray that the people who are coming to the courses and who are starting those programs aren't doing it from a monetary based place, but from a place of heart and providing value.
Well, I think you could probably bring both of them in, but we have to definitely kind of like expand like into things like you're talking about, different tiers of service, and then also like educating some other people.
I'm not into, providing pelvic health services and having someone treating 2 patients at once.
Right. Right.
The things that we do.
Right. Looking at different models of care.
Yes.
And we're going to have to adapt and adjust. And there may be a time that you see somebody, like I always said to people, you've just got to be that good now. Like, that's what I always felt like moving, I definitely felt like in 2005 when I was like, I'm going to do this boutique-y thing or whatever. It's like this foreign kind of thing. But I was like, it wasn't me dumbing myself down. It was that I was adapting to meet the people where they were. And if they were in a, fitness kind of mind, and we're going to go look at Cosmo magazine to try to find that workout for their abs post baby anyway, why don't I intervene as the educated person? And I think we have to evolve as health professionals to be a little bit more open to being
and
that
I
intervention.
Want to help people monetize. Absolutely. Because if you can't grow, if you don't have the money to support you. And yeah, I am all about, helping people make money, but, I just come to pelvic health and breast cancer rehab from a place of heart. And it has required a lot of sacrifice from me for the past decade, which I have been very happy to give. But yeah, I mean,
well, we need the societal support.
Yeah,
because we can't wear out people like you who are changing the look of breast cancer well-being, because that's really what it is.
Going back to breast cancer care and why I'm, not stopping at kickpink.pro, which is education for providers, but going on to kickpink.com, which is education for people who are going through breast cancer treatment or who have gone through breast cancer treatment, is because we are not making big enough waves yet in breast cancer rehab. And the people who physicians listen to most are usually the patients.
Right.
And when they get smarter, they can really help physicians, medical staff, rehab practitioners think and help rework everything.
Right. So we've got to be writing the books. We got to be going on the podcasts like this. We've got to be be out there in the articles and
But the way that KickPink, my mission for KickPink is that kickpink.pro for practitioners helps people who have breast cancer, and kickpink.com for people who have breast cancer helps the practitioners.
Love it. Love it.
So what I intend to do is, I do have my certification course for people who take the online course. It's now online, but it's also supported. It does turn into a KickPink certification in comprehensive breast cancer care, but there will be other courses and there will be some collaboration that takes place with other people in this field as well, and other courses that are available to practitioners. But there's going to be a spin in taking some of that general education and putting it on kickpink.com for the general public to be able to access.
Right, of course.
And then that information will also harken back to practitioners who are in the field, who have been trained, that are specialized in this area, so that people know how to get to those people.
Right. Because it needs to be a circle now.
Yes.
It really is not a hierarchy. It needs to be a round table.
Right. We aren't really taught as rehab practitioners about how to do marketing.
Right.
And nor do we have the time. Right.
Yeah. Like you mentioned Herman and Wallace. And I think, that's where we either took courses in APTA, if you're back in the early 2000s, you're APTA or Herman and Wallace, that was like your options there. And they did a really good job with the kind of instilling that sort of done for you, let's make it easy with the billing sheets and this sort of thing to establish it. And it was very helpful. And then people went off and were able to do it, because that's the thing. I know with my Mind Body Brand Academy, that's one of the things that over the past 3 years, I've kind of, we all know, right? We all know, or we learn what we're supposed to do, but how do we actually implement it? And I was noticing that people kept on coming back and back and back, which I loved. It turned, I intended that to be like an 8-week, you take it, you learn and go. And then it sort of turned into its own little membership, because it's that implementation and coming those 8 weeks, wherever you are, and actually being held accountable, and then given some resources where you are to get it going. Because I think a lot of us as professionals, and maybe people listening to this, you're not professionals, but you do this too. sometimes we run to the, let me know more, 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 let me make dreams, let me have ideologies, let me, feel so good filling in a gap. But then we hit that barrier into practice, either because how are we going to set up our business? How are we going to set up delivery? How are we going to set up our time to be able to, and then how are we going to stay healthy ourselves? Because we don't want to be walking around being the walking wounded, trying to take care of everybody else. So
Absolutely.
I think that's, kind of a good model.
And so that's what I'm trying
going
to get the point across, is that this is not just a course. It's not just a certification. Like Kick Pink is a movement.
Yeah, love it.
Yeah, you get to know me, and you get to know my mission, and you get to know my goals to benefit everyone in the future. And like you said, like I really am someone who has specializations in pelvic health and breast cancer, who are coming up with answers, but also solutions.
Right. Because you've walked the talk. You're
Absolutely.
not just, you've walked it. That's really great. So I can see where it is in the future if it all pans out and everybody kind of like goes into that. So tell us very clearly, and I'll put everything on the website. So I hear there's kickpink.pro. Tell me all the websites where we could find you. And where's the best way to get your stuff right now?
Yeah. So this might be an interesting conversation, because I know that, and I'm not trying to make it a conversation, but I'm just kind of letting you know that like the reality of business, right? Mm-hmm. So, yourcorept.com is where you can go and get everything right now.
Okay.
That is where people can book to see me with patient care. That is where practitioners can go to get done for you patient education handouts and pelvic health and breast cancer rehab. Right now we have the bladder book, we have the bladder bundle, we have, the breast bundle, all of these hundreds of patient education handouts that have been done for you, that you can personalize with your own logo and information, that you can print, that you can get in book format, that you can email to clients. Those are on yourcorept.com underneath the practitioner portal.
Okay.
You can also go and register for the course right now at yourcorept.com as well. So the yourcorept.com came from like, well, how do I blend pelvic health and breast cancer rehab? And it's been frustrating, because sometimes people are like, your core PT means nothing to me. I don't get it, and the thing is that we started today talking about collaboration, and I'm not someone that wants my brand necessarily to always be me. Right.
Mm-hmm,
like I'm the person behind it that have gotten these businesses started.
Well, like you said, you're doing a movement.
Right. But I really would like to, where I would like to be in the future is Kick Pink will be my baby and will always be my baby. And I will execute that with collaboration with others. But I am also creating pelvichealthresources.com. And so that is going to be launching soon. The reason why I started that website, pelvichealthresources.com, for the patient education handouts, is because it's going to give us a lot more options in terms of purchasing ability for people. With individual handouts, like you'll be able to get the handouts individually. You'll be able to get them in PDF print template format so that you can personalize them, all these things.
So basically,
and it's going to be so much more streamlined.
Whoever's listening to this, who is a practitioner in this area, like you'd be stupid not to.
It's crazy.
Go to your stuff and make it easier on yourself.
Absolutely. Right? Absolutely. And it's so funny because it takes really like it takes hundreds and hundreds of hours to take all of this information.
Saving that for other people to empower and enable them.
Yeah. And I think it comes out to be like $3 a handout when you buy a bundle, and you get to use it for the life of your practice. Like it just makes sense.
Right.
But what I want to say here, this is why I'm moving it over to pelvichealthresources.com, is because I want yourcorept.com to be for patient access.
Yeah,
and
practice.
I really want to collaborate with other practitioners in pelvic health and breast cancer rehab. So, like right now I'm writing the pregnancy and postpartum bundle with Pani Nazari and the pelvic pain bundle with Jen Vandevent. And Megan Pribble is doing a little work with nutrition stuff. And Ginger Garner is coming in and writing some handouts, applying integrative health and yoga practices to bladder and bowel stuff, so I am all about collaboration, and not just with handouts, but I think pelvichealthresources.com is going to be an excellent way for people to get resources that help them in the clinic and knowledge and collaboration in the future. So I'll say more about that later.
I love all of that, because that's very much what, I am always talk about this like curvy hustle. And it's this mentality of how can we make business more conscious, in my view, a little bit more feminine styled, because I think this is how women,
Absolutely.
This was our gift, was not to necessarily show how we can be one of the boys, but to literally decide to show a different force. We could use that other aspect of, that one, wolf at the top.
Oh,
or the
totally.
leader of the pack.
Right.
And there's a place for all of these things, maybe for initiation or catalysts like 10 years ago when there is nothing and somebody's got to bring that in. But at some point, how can we help with conscious, everybody says capitalism's back. Capitalism's not bad. Unconscious capitalism,
right.
greedy ass, crazy capitalism, total individualization is bad. Like it's more about the self and coming back to kind of like how we work. So I love everything you said.
And like talking about the curvy hustle, like I am not a competitive person.
Mm-hmm.
I work so much better competing when it comes to a team style format, but usually in the flavor of fun, not to beat anyone. And so, I just do come, my joy is sparked so much more in that collaboration piece. And talking about the curvy hustle is knowing how to trust your intuition of who you want to work with.
Yes.
What they value.
Yes.
How to, yes. And,
because it's an energetic hold. That's really what we're doing here, right? We're
so
figuring out
are you
how to
speaking
combine
the
our
same
energy.
language? Are your values similar? And of course there have to be contracts and things of that nature just to protect everyone and get everyone on the same page.
Communication. It just makes it easy.
Absolutely. But like, I just think that I am not one to want to be any brand of Susannah Haarmann. I know a lot, and I take a lot of joy in working with other people and also putting them on a pedestal.
Right. I hear you.
I mean, it's
about bringing ourselves. I think there's a place for our voice and our ownership of things, but not in an elitist kind of, it's more of like a leadership. My big thing now is, look, we don't need any more lady bosses. We don't need any more girl bosses.
No, we don't. No.
We need lady leaders.
Yes.
We need leaders. And then eventually, once we are leaders, finding.
But we need authenticity.
We need authenticity, and we just need a different. I mean, this could be a whole conversation in itself, a whole podcast, and maybe we'll come back to talk about that. But like having just a different look, like what we just described feels very natural for us talking about it. We've probably been using it and working it, but it hasn't necessarily been something that's honored in the system.
Mm-hmm,
and
absolutely.
It's because there's a certain, but I think again, with all of this, with all of the pillars of society sort of coming down, it's going to be a little ugly, but it's going to take, like, we've been working on this. We're like, this is our jam. And it was just a matter of like having to get to a place where we're like, we went through boot camp, you know what I mean? But it's going to be a lot harder. Long story short, it's going to be a lot harder for people who don't understand how to do things like this to function well, or there's going to just be there's going to be a period where there's a big divide. But as long as you keep doing your thing, I keep doing my thing, we keep seeing more and more women leaders really taking, I mean, the evidence is there. Nothing bad happens when women make a lot of money. The corporations that have women in their leadership tend to have better, financial spreads after a couple of years. I mean, the evidence is there. It's just that we've worn this cloak of invisibility, and it's a weird kind of cloak because we've been there, But yeah, we could have a whole talk on that on itself. But again, thank you for sharing.
I have so many things coming up to my mind right now.
Because this is really where it's at. And maybe we'll have an after talk, and I'll keep that for special kind of secondary kind of thing. But thank you, Susanna. And I will have everything on the show notes. Make sure you check in with her if you are a practitioner listening to this, if you are involved in women's health, breast or pelvic care. Look into the things that she has either at the public level or professional level.
And I just want to say, like, the two, pelvic health and breast cancer rehab are so complementary, but also if you are an orthopedic private practice owner, or if you just do general orthopedics, look into breast cancer rehab. If you're a lymphedema therapist and, you're kind of like doing the same thing day in and day out, and you're like, okay, I want to like spice things up, think about breast cancer rehab. It's an incredibly underserved area, and it is so rewarding. People think that working with oncology patients must be so sad and so depressing. It is not. It's actually the most rewarding population I've ever treated.
They've been given a second lease on life. They've been they faced it in there.
Thank you so inspiring. Thank
Susanna,
you.
Thank you so much. And for you guys listening to Owning Her Health, thank you so much for being here. And I'm sure we're going to have another conversation because me and Susanna can go on and on.
Let's get it.
Take care, everyone.
Bye.
Thanks for being here.
Thank you for listening into this episode of Owning Her Health with Dr. Lisa Haarmann. To learn more about her personal and professional development service, visit her online at drlisahollandpt.com.